time for us to lead and act from our hearts and our heads. As one of my colleagues said to me just yesterday, it's a time for us to maintain rational thought while cleaving still and always to empathy and compassion. This idea of health centers needing to shut down is a terrible prospect now, and on a national level, we have to do everything, and I really mean everything possible, to financially support health centers now to stay open so we can continue to serve the 28 million people we do while we undertake all these crucial measures that threaten our very existence. This crisis is huge, and it's threatening, and it's frightening, and at times it feels like it might be too big. I think all of us have had these moments. So I think it's important time now to remember that our movement started with a task that was frightening and threatening and too big. And I think we do it by continuing to draw on our central values and by recognizing that we're community health centers not just because we want to serve communities, but because we recognize that our strength comes from our communities. And so we remind ourselves and we remind our teams and our colleagues that when the task seems much too large and when we're afraid, as many of us are, that most of us share these similar feelings. These are some of the same feelings our patients have always brought with them when they come to see us, when their illnesses and their poverty and their oppression seems just too much. And at these times, I think we all tend to feel lost, and not just lost, but often that sense of being lost and alone in a really dark place. And when the problem is bigger and harder, and when it doesn't have a simple or clear answer, as healers, we know that we still have powerful medicine to offer even when we don't have a cure. We know how to say to our patients, I know what it's like to feel afraid, and I know what it's like to be lost in a dark place, and we know how to say this to each other. We know how to tell each other that we're familiar with that place, that I've been in this same place many times and with many people, and I'll be there with you, and I promise you, you will not be alone. We'll do this together, and together we can bring some light in here, and together we'll find our way forward. We are not helpless now, and we are not beaten. As has been said, many will die, thousands, maybe more, and each will be someone's family, someone's child or parent or loved one, and we will mourn each of them and will grieve. But we'll also save thousands and many more, and each of them will be someone's family and someone's child or parent or loved one, and we'll save them with our work. We'll save them as we've always done by connecting with them personally and compassionately and with respect and dignity and trust. We'll save them by effectively treating their illnesses and addressing their fears so that they can stay out of the ERs and be home and be safe. Each person we help with their chronic illness so they can stay home. Each person we listen to and counsel so they can stay home. Each is someone we protect from danger. We know how to do this, and we're quickly learning to do it in ways we never imagined. We are not helpless now, and we're not beaten.